My name is Diarmuid O'Donovan. I'm the Senior Lecturer in Social and Preventive Medicine in the College of Medicine, Nursing and Health Sciences, and I'm also the Director of Public Health in HSE West. And I've got an interest in development from working in health and development issues. I've worked in various African countries, lived and worked for 7 years, and I've been involved in research projects in Sierra Leone and Sudan today and in some other countries as well. So I just want to talk to you about how health and development has got onto the curriculum here for undergraduate medical students, and just think about how that might relate to your teaching and your work as well. So this starts with, oh no, I'm pressing the wrong button sometime. Okay, this started with students, okay? A few years ago, students started asking why things weren't on the curriculum. They were recognizing that there were all sorts of things around major health issues in the global south that we weren't including in their education. And we have students from all over the world. We have a small number of students who are interested in humanitarian issues and in aid issues. And they were saying that there was nothing on the curriculum related to this. There's an increasing interest in the relevance of international health policy. 10 years ago, Ireland was getting used to being a country with net immigration. So there was new cultures appearing in Ireland. So students who were training to be doctors in Ireland were having to deal with new cultures on a scale that had never happened before, as well as the fact that an awful lot of our students migrate and have to deal with other cultures when they go away. And then lots of students are involved in all kinds of charities and volunteering, some of which they were questioning, how these worked or how the processes that made these things function. So how we started is a group of staff and guests from outside, we started offering an optional course to students. These were on Tuesday evenings at 5 o'clock with an optional series of lectures. And we found that 75% of the class were turning up. We set an assignment the first year, and 20% of them wrote an optional assignment. Like, they're busy, and this was write a newspaper article, something you're interested in. So we knew this meant there was a problem. We weren't meeting their need, and they wanted more on this. So the wider context around this is that the Millennium Development Goals were published in 2000. The idea of a global health curriculum was starting to evolve internationally. In Norway, in the UK, in Canada, people were starting to include this for health students, nurses, doctors, other health sciences, to address some of these issues, from travel to migration to culture to aspects of aid to diseases and aspects of health and disease that are seen in other parts of the world. I'm also part of a group called the Irish Forum for Global Health that was set up to try to identify and link people who are interested in both education and research and advocacy around these issues. So the timing fitted. Now, there's an American think tank called the Institute of Medicine that looks at medicine in its widest, it talks about new drugs and all that kind of things, and looks at policy, but it also looks at education. And it came up with the idea that distinctions between domestic and international health problems are losing their usefulness and are misleading. And the same thing probably applies to aspects of education. And there have been huge changes in terms of knowledge that are impacting on the most poor, the poorest places and the poorest people very quickly. And they also stress that there's a new generation who see these interconnections in a way that older generations haven't seen, and that we need to focus and address this. So other contextual things, over the last few years, you're aware that Irish Aid produced a white paper on aid, the first white paper, first government clear policy on aid that included aspects of development education. And in wider medicine, groups like The Lancet, which is a leading medical journal, now has a global health portal. It includes, it's got a global health TV channel, it's got global health articles, it's got, there's a recognition this is something central for medics. There's new resources. Have any of you used Gapminder? You need to use Gapminder. You need to learn Gapminder. If you remember nothing else I talked about today, look at Gapminder. This is developed by a guy called Hans Rosling in the Karolinska Institute, and it's the most brilliant resource for information and showing people how to use information and statistics. We've had a reference to global inequality already. This is just a map showing where the most child deaths happen. And the world is very unequal. And students, young people, everybody recognizes this, but people want to know how to do something about this. So for our students, in terms of working as clinicians, it's important to know about other cultures. It's important to be able to communicate with people. We have lots of communication skills. It's important to know about migration, both for dealing with migrants and for migrating ourselves. And it's a key part of people's careers to have some understanding of these issues. We also need to understand diseases, treatments, and health systems in other parts of the world because it's relevant here and other places, and we need to know about the interconnections. And there's the wider professional idea about awareness of inequality and awareness of how the world works. And there's the role of the doctor as advocate, but the teacher as advocate. Everybody has a role in advocacy. So we've come up now, our latest learning outcomes address a whole range of issues, but these are sort of the themes. We want people to understand about the global burden of disease and the interconnections between diseases. We want people to know more about socioeconomic and political determinants of health. And elements of this are in the curriculum in different places, but we want to have a focus for it as well. People need to know more about health systems and travel and governance, and we want to include specifically elements of human rights and ethics that relate to these issues. And we're increasingly including aspects of cultural competency and training in cultural competency within this. And there's huge amounts of resources around this. The world is changing very rapidly. We don't have diseases of the developing world and diseases of the rich world as much anymore. The whole world is heading towards non-communicable disease. The vast majority of us who are born or alive today are going to die of cancer or heart disease or these big non-communicable diseases. It's not malaria and HIV, which are big burdens in some places. But the reality is that for the majority of people, non-communicable diseases are the issues. This issue about the determinants and all of the different aspects that impact on health, this is just one model that shows that the health system and medicine is only a tiny part of the things that impact on health. And people need to know much more about the social and political environment, about ecosystems, about other things like that that impact on health, as much as on other aspects of life. And this whole, as I mentioned, cultural competency, there's new curriculum and curricula are evolving in different countries to address this. So we're trying to include more and more of this. Now, should this be a one subject area, or should we try and thread it through the curriculum? Well, we're trying to do both. But we're the first medical school in Ireland to have a focused piece on this in the curriculum, and now the others are doing it as well. And we're trying to thread it in. Eventually, in a generation, hopefully, it's something that won't need to stand alone, that it'll be something that will go across the whole curriculum. So what we hope, ultimately, is that we'll have graduates who are going to have global careers. They're going to be dealing with patients and populations all over the world, even if they never leave Galway. Increasingly, doctors have some element of humanitarian work, even if they never leave Galway. But a lot of them will do short stints in different places in emergencies, which is quite a different thing to dealing with development. And we need to have a lot more clearer understanding about issues about emergencies and humanitarian aid and dealing with critical things like that, around what's charity and what's aid and why people should contribute to this sort of thing. And increasingly, like our students, some of them are going to be politicians. Health in Ireland was a medical student. The other people who do, like you're going to be teaching people who are going to be the politicians of the future as well. So there's policy that's relevant for them all to understand. So I literally just want to give you that sort of an overview as how we started to develop this and see if it might have some resonance for what you're doing yourselves. Okay, thank you. The Prezi work.